Hello and welcome to the Doctors of the World webinar on entitlement to healthcare for refugees and vulnerable migrants. So we'll be looking today at people's entitlement to healthcare in the UK if they're a refugee or a migrant, and how you can support these patients to access your service, particularly if they're in a vulnerable situation. So what we'll be looking to cover today is we're hoping that we'll get a clear understanding of entitlement to NHS healthcare, to have a better understanding of the different barriers that exist that might make it difficult for people to access NHS care. And hopefully we'll finish the webinar with a greater understanding of why access to healthcare is important for this population group. We'll also be looking at some practical steps which practices may be able to take to address barriers which might be making it difficult for migrants in a difficult position to access healthcare. So my name is Phil Merwell. I'm from Doctors of the World. We run a clinic in Bethnal Green. We're part of the Médecins du Monde network, which is an international NGO which provides healthcare around the world. In the UK, we run a clinic in East London in Bethnal Green, where we support people to access health services. So we run a drop-in clinic which anybody can attend, and it's staffed by volunteer doctors and nurses and healthcare advocates. And we see people once and then link them in with mainstream services, so typically supporting them to register with a GP. Last year we helped just under 2,000 people, and that's been fairly steady for the last 10 years. So just a brief overview of who we see in our clinic. So when we're talking about the experience of different patients today, we'll be basing it on our experience in the Doctors of the World clinic in Bethnal Green. And so it just might be helpful to explain our experience of working with a migrant population. So in terms of people's immigration status, the majority of people that we see are either undocumented or they don't have a clear immigration status, and we see some people who are still in the asylum system. People come from a broad range of countries. From the Philippines, we see lots of people working as domestic workers. But I think what's interesting about the country of origin stats is the 53% coming from 76 countries around the world. So really there's quite a broad range of nationalities who come into the clinic. And what we notice is that people tend to have been in the country for a long time before they access our services, let alone any other healthcare services. So we're typically, so the average that we have from the data we collect on our patients is that people have been in the country for 6 years. So it tends to be that when somebody becomes sick, or when they are, when they have to see a doctor because they're pregnant or something else occurs, that they then try to understand how the healthcare system works and how they can see a doctor. So it can be quite confusing to try to understand what different immigration statuses are, and this webinar isn't really about that, but we'll just try to get a brief overview because it does have an impact on what services different people are able to access. And often in the press, particularly, different immigration statuses are often used interchangeably, but they do mean different things. So an asylum seeker is somebody who's left their country of origin because they fear persecution and have asked for asylum in another country. But that process is still ongoing, so they haven't been yet given a decision by the government in that country. So that's an asylum seeker. And a refugee is somebody who has been given a decision. So they've claimed asylum, and the government has recognised that it would be not possible for them to return to their country of origin because of the fear of persecution. So that person has refugee status at that point. If the government declines their claim, then that person becomes a refused asylum seeker. And depending on their situation, they may be able to appeal with fresh evidence if they have that, or they may remain a refused asylum seeker until they're removed from the country. And somebody who is an undocumented migrant would be somebody who is entering or staying in the UK without the documents required under immigration rules. So they may have entered the country through irregular means, or they may have overstayed a visa. So they may have come initially on a visitor's visa or on a working visa or a student visa and may have overstayed that visa. So that person would be an undocumented migrant. So Undocumented migrants cover a huge range of people themselves. So that includes people who have been trafficked into the UK. So that would be people who have been brought into the UK either against their will or under false pretenses, and believing, for instance, that they may be coming to work in a particular setting, and then on arrival finding that that isn't the case, and that they're working, for instance, without pay in an exploitative situation. It could be people who have entered the country and who have fled a conflict or have fled persecution back home, but haven't yet claimed asylum because they haven't been given good legal advice. So we see quite a lot of people who are being advised by people in their community that they shouldn't seek legal advice and that they shouldn't claim asylum because they'll just be sent home. And so that can be an issue for people, sort of hearing rumours from their community about what they should or shouldn't do. There are people who come to work in the UK and they don't have the required visa. So they might be working, the people that we see are often working in domestic settings, so often for quite wealthy people working in sort of in household settings, so looking after children or cleaning houses. Otherwise, we'll see lots of people who are working in restaurants and in nail bars, and the people who we see won't always have the requirements needed to work legally. And obviously with that goes issues of the risk of exploitation and not being able to enjoy full labour rights and other complications which can occur with that. Okay, so when we're looking at entitlements to healthcare, we'll be drawing from the Department of Health's guidance and from NHS England's guidance. But it might be helpful to frame it in the story of Miriam, who is based on somebody who came to the UK. Who came to the Doctors of the World Clinic in 2015. So she was somebody who had left her home country, and this is an anonymized case study, and we had her consent to use it as an anonymous case study. So she was somebody who had fled to home country following abuse there and following, trying to escape the situation that she was facing there of being forced into military service. She travelled overland through Africa and through Europe, and after a difficult journey was able to get to Calais, and from there was able to get to the UK. It wasn't easy when she got to the UK, and she was homeless and was taken in by somebody who found her on the street. And this is quite typical of people who are destitute and who are in an extremely vulnerable situation, is that they tend to be picked up by people who find them on the street, and so it might be from a religious organisation, and then eventually after a few weeks might then bring them to a charity or an organisation such as Doctors of the World or other migrant advice services. So when she came to us, it was clear that we wanted to register her with a GP, and so that she could access mainstream care. We were worried about her mental health really, but we knew that as she was pregnant, it was going to be important for her to be seeing a GP, and then for her to be able to be referred for antenatal care. And because of the history of sexual violence that she had, we were keen that she access some sexual health screening as well. And the risk with somebody like Miriam not being able to access mainstream healthcare are quite clear, really, that she might develop complications during the pregnancy, which obviously would be a risk to herself and also to the pregnancy, to the baby. With that, there could be more pressure actually on health services, because the person would be, for instance, more likely to go to A&E. They might be using more expensive resources by having a complicated birth. So essentially, what we're trying to encourage is that people access healthcare in an appropriate way, and in doing so, we're hoping that we can prevent things becoming complicated or requiring further care later on. And so at this point, it could be useful to reflect and think, if somebody such as Miriam came to your GP practice, so somebody who's staying with a friend or a stranger in this case, and so won't have a utility bill, who won't have ID documents, and they came to you probably quite scared of presenting to what they might feel like is an authoritative place, a place linked to the government from their perspective at least, how would they be able to access your services if they came and said, well, I don't have a utility bill, I don't have ID? Would they still be able to register, or would they be asked to go away and to find those documents and to come back? And what would the complications be for yourselves in that situation? So we'll be looking at NHS England's guidance around access to primary care and entitlement to primary care. So in this guidance, it's very clear that everybody who's living in England is entitled to access primary care, and so the person's nationality or their immigration status isn't something which is relevant in terms of them being able to register with a GP and being able to see a GP or a nurse. So that's the same as whether somebody's homeless or able to demonstrate where they live, or whether or not they're lawfully living in the UK. It wouldn't be for a primary care provider to determine that at this point. So clearly somebody who is in Miriam's situation, who doesn't have ID and doesn't have proof of address, might face some issues, and these are sort of typical of what we see at the Doctors of the World Clinic. So the first thing is that she might well not understand that she's entitled to see a doctor, particularly if she doesn't have any money. She might come from a country where you would have to pay to see a doctor, or you'd have to have insurance in order to see a doctor, and so people often aren't aware that they're entitled to see a doctor for free. People are really scared of the Home Office, so people are really worried that because they don't have their papers in order, that if they access any point of the NHS, that the Home Office will find them, and that will put their situation in jeopardy, and then they might be forced to return home to whatever they've escaped from, whatever they've left. And so we see quite regularly that prevents people from approaching GP surgeries in the first place. Clearly, some of the time there are language barriers, and this can make it difficult for people to fill out the paperwork that they might need to do, or to explain their situation to a receptionist. And there are also admin barriers. So we know that some GP surgeries around London ask questions about what people's immigration status is, ask people for proof of ID, and ask people for proof of address. And clearly there are good reasons why GP surgeries might want to ask for proof of address and for proof of ID, to understand if somebody's living in the catchment area, or to understand if somebody is who they say they are. And what NHS England's guidance is really good at explaining is that it's not a problem for GP practice to ask for proof of ID and proof of address, as long as it's done consistently and all patients are asked. But the key thing is that if somebody doesn't have a proof of address and if somebody doesn't have a proof of ID, that shouldn't be something which will prevent them from registering with a GP. So for somebody not to be registered with a GP, there must be reasonable grounds to decline the registration, and that would be required to be provided to the patient in writing. And the NHS England guidance explains that reasonable grounds doesn't include not being able to provide proof of address or proof of ID. And so when Miriam did go to register with a GP, she was turned away initially, and it was for the reasons that we've just been through. That she was asked to show documentation that she didn't have, and she wasn't able to do it. And she also wasn't able to explain fully what her situation was and why she needed to be able to register with a GP. So she came to us, and we were able to support her with that registration process, but it took some time. And so by the time she was referred and linked into antenatal care, she was 29 weeks pregnant, so she had missed some important scans by that point. So we looked at the different GP surgeries across London. So this isn't just Hackney, but across London, where we had been supporting patients to register with GPs in the area that they are living. And we could see that 39% of the time people were being turned away from GP surgeries, often because of bureaucratic barriers, so people being asked to provide utility bills or proof of ID, which they didn't have and weren't able to access. And this is a breakdown of those reasons. So yeah, it was proof of address and proof of ID being asked for where the person wasn't able to supply it. On some occasions, people were registered temporarily, and temporary registration is for somebody who's in an area for over 24 hours and for less than 3 months. And that's explained by NHS England in their guidance as well. So it might be useful to be able to have an understanding of what is shared with the Home Office, because this is one of the key barriers that we see that will put somebody off accessing your service. So currently the Home Office has a memorandum of understanding with NHS Digital, which enables the Home Office to access NHS Digital's information. So NHS Digital will have to share non-clinical patient information for reasons of immigration enforcement. So if somebody goes to any NHS provider and their details are put onto NHS Digital, at that point their information will be available to the Home Office should the Home Office request it. And this is something which is it's proving to be a significant barrier and is really putting people off seeing a doctor, not just in primary care but in secondary care as well. For obvious reasons, that people are worried that if they do go and access healthcare, then it's going to have an end result of them being picked up by the Home Office, potentially detained and removed from the country. And what we're seeing is that people would rather take a risk with their health and with their family's health than take that risk of being potentially removed to whatever the situation is in their home country, which they've obviously left to come to the UK. And so another exercise which GP surgeries can consider is with somebody like Miriam, who won't speak a lot of English and who will be quite nervous about accessing the service, who won't know what she's entitled to access, who's pregnant and who's experienced significant distress and high stress situations in her journey to the UK. How could the surgery make itself more accessible to somebody like her, whether it's through the registration process or during the consultation itself? So some recommendations which Doctors of the World have produced are around making GP surgeries more accessible for patients who are in a vulnerable situation. And so that includes not asking patients for a visa or for their to demonstrate the immigration status. This isn't a requirement as we've seen, and this also can cause a patient to get worried about what's happening with their information and whether the GP surgery is going to do something with it which they shouldn't do. On the new GMS1 form, there's a section where people can fill in about their entitlement to secondary care. And this part of the GMS1 form is optional for patients to fill in. So if somebody doesn't fill that in or isn't able to or chooses not to, that shouldn't prevent the GMS1 form being processed. So if somebody isn't able to provide proof of ID and proof of address, it shouldn't stop registration, but also what it can do is flag up that somebody might be in a more difficult situation, and so there might be a reason that they're not able to provide that proof of address and proof of ID. So it might be that there are actually greater support needs there, which could be explored by the GP, or could be flagged up with the GP or for the nurse for the first consultation to explore a bit about why it is that they can't do that. And it might be that it could be explored as to what the housing situation is like. Are they sofa surfing? Are they at risk of homelessness? What's their work situation like? So there might be a variety of reasons why somebody might not have those documents. And so rather than being a barrier to registration, it could be something which actually enables the GP surgery to provide greater support to the patient. If somebody can't communicate with the GP, they're not going to be able to explain, because there's a language barrier, they're not going to be able to explain how their health is. And obviously, bringing in a friend or a family member can be detrimental to confidentiality. So it's important to use an interpreter where possible, whether it's a telephone interpreter or a face-to-face interpreter. If somebody is homeless or sofa surfing and isn't able to receive mail at a place where they're living at, particularly if they are street homeless, then there may be other ways that they can receive their important health documents. So whether it's their test results or letters from hospitals for referrals or letters from the GP. So it could be that they use a day centre, a church, or somewhere where they access on a regular basis. They could use that as a care of address. They might have a friend who's happy to receive mail for them, or it might be that the GP practice is able to register the patient with the practice's address as their care of address. And so, particularly with patients who are street homeless, that's where ensuring that patients are still able to access that practice and are still able to receive their documents. And obviously, they'll just need to be sure that there's a way to communicate with the patient to inform them when they have letters from the hospital arriving at the practice. And there are some GP surgeries who are able to take a holistic approach, and this is seen as good practice, where there might be other areas that people can be signposted to, which in turn could take pressure off primary care when people are attending GP surgeries for things which aren't necessarily health related. Having an awareness of where else people can go to get that broader social support can be beneficial for staff. So having an understanding of where people can go to access housing advice or immigration advice or support groups can be really useful. And so the CQC now asks people to take into account the needs of different people, including those in vulnerable situations. And so GP surgeries can look to have a registration policy which does protect people who are in a vulnerable situation. And so that could include ensuring that there are interpretation services available and that staff are trained to spot red flags where people might be vulnerable, whether it's because of their previous experiences or because of their kind of vulnerabilities in the UK. Do staff understand and respect people's personal, cultural and social and religious needs, and do they take these into account? Another consideration by the CQC. And so surgeries can consider how the practice is a safe and welcoming environment for vulnerable people, including migrants. So whether this is if there's information available for migrants about services which are relevant to them, or whether it's that staff understand that there might be particular needs which different groups have. Within Hackney, there are some organisations which it might be useful for staff to know about, so that they can signpost patients to these services. And this is just an example. This isn't a comprehensive list. So there's the Hackney Migrant Centre, which has a drop-in every Wednesday, and so they provide a hot meal for people. But also they have immigration advisors and advisors who can give support on welfare and other legal services. And people can go there and it can help reduce isolation. There are sometimes classes there, and people can know that it's an organisation which isn't linked to the Home Office, which is what people are worried about, and so they can get free and independent advice there. For women who are pregnant, who may be quite isolated or who don't have a strong support network, who don't have a wide family, Bump Buddies is a good organisation to consider signposting the people to. And having an idea of your local food bank and being able to hold food bank vouchers in the surgery if somebody's struggling to provide food for themselves or for their family can be really important. There are some useful resources here, and we can make sure that these links are available so that they can be clicked through. And Doctors World can also deliver training in-house to admin or to clinical staff if that's more preferable. And so please just get in contact with Doctors World to explore that further. And yeah, so thank you very much for taking the time to go through this webinar today. And if you do have any questions or comments about it, then please don't hesitate to drop me a line at the email address on the screen. And yes, if you would be interested in training for your GP surgery from Doctors of the World, from one of our volunteer trainers, we'll be happy to speak to you about that.